We have survived another week of the session, so yet again, we're back to tell you what went down and what's coming up. He's Nate, and I'm Andrew, and this is the DLC's Policy Corner.
As usual, we'll kick it off with the budget. With the every other day meetings we mentioned, we've still only had two more meetings from the Social Services Appropriations Committee at this point, so there really isn't a ton to report yet. They did hear a request from the governor's budget to increase rates for the new choices and aging waivers. These waivers help folks receive care in their home rather than a nursing facility, and we have had some concern with rates and this causing too many folks remaining institutionalized when they could be in their home or other community-based setting. We shared those concerns with the committee this week, and we do hope they will fund this request.
One bill we did speak to this week was Representative Clancy's House Concurrent Resolution 6, which asked the federal government to block grant funds from the Department of Housing and Urban Development so the state has more flexibility than that Housing First model. We were worried about sustaining sufficient funds under a block grant. We're also concerned about de-emphasizing Housing First when we don't have enough affordable housing in the first place. Additionally, we don't think it makes sense to continue to focus on costly facilities when community-based alternatives like permanent supportive housing aren't adequately resourced or implemented according to evidence-based models.
As mentioned last week, we were hopeful that the supported decision-making bill would be out soon, and we did get a public version this week. This year, the bill number is HB 334, and again, that's from Representative Abbott. We suspect it'll end up in a committee he chairs, the House Judiciary, so we'll have to keep you posted on when you can come support that one. One thing we do want to remind folks, because we're still hearing these concerns, is that this bill doesn't take away anyone's guardianship. It just creates yet another option for people to use if they want to.
We had a couple other concerning guardianship bills dropped this week. First up is SB 167 from Senator Reeve that directs courts going forward to make a determination in a guardianship proceeding whether a person retains the right to vote, but retroactively, it presumes a person with a guardian doesn't have that right. We've talked to her, and we're confident we can improve this one.
Also, on that note, we just saw this, so not a lot on it, is Senator Stratton's SB 199, which creates a whole new guardianship for those with a severe intellectual disability, and it exempts them from the Guardianship Bill of Rights if they have a full guardianship. This is concerning for a number of reasons, so we're going to have to learn more about it and keep you posted.
Another bill we've been working on with Senator Abbott came out this week, HB 338's Commitment Amendments. This is the bill we worked on last year with Representative Abbott that expanded the rights of a person with mental illness in an inpatient setting. The bill couldn't get through last year because of a small fiscal note, but we were able to get that taken out this year. We hope. So let's hope the second time is the charm for this one.
We also have concerns with HB 312 from Representative Lisenby. It's a large criminal justice bill, but she snuck in a provision that makes it a misdemeanor to wear a mask in public places with other people wearing masks if they intend to conceal their identity, like hospital waiting rooms. Given that many Utahns with disabilities need to wear masks, as do those around them, for their safety, it's highly concerning that this could be a crime, especially since the bill defines things very broadly. Even if they could mount a defense, they could be charged and forced to deal with criminal charges. We've engaged a lot of folks in the public health space on this, and I think a lot of us are going to be pushing back on it.
One bit of good news is that Representative Daley Provo's Medicaid bill that's been around for a few years is back. This is the one that requires the Department of Health and Human Services to seek permission to offer a person with a disability who makes too much but whose private insurance doesn't pay for all the services they need, wraparound coverage through Medicaid. It's HB 310 this year, and let's hope for better luck this year.
Well, A lot of bills have dropped, but we haven't had a lot in committee yet. So one of these weeks is going to get real hot with legislation in the committee. That doesn't work as well without my hoodie. I'm sorry, I didn't have it this week. But until then, you can follow the bills and budget items we're following on our trackers, as well as the meetings we've been following, which are on our website, disabilitylawcenter.org/issue/public-policy. Almost messed it up there. As always, thanks for watching the Policy Corner, and we will see you next week.